4PI. So what are they?
Principles, purpose, presence, process, impact.
4PI.
What we want to do with the 4PI framework is to sort of hardwire this kind of notion of involvement into services so that there is a framework to hang it on, to make it sort of more robust and hang in there for longer, not just be sort of discarded with the next restructuring of the Department of Health and Services. We want to see it stay.
It's all about strengthening the ability of service users and carers to get their voice heard.
The key point is respect and equality in working relationships. The service user and carer are on the same level as staff, otherwise it doesn't work. Meaningful and inclusive involvement starts with a commitment to shared principles and values. The purpose of involvement needs to be clearly stated and agreed at the very beginning. Everyone connected with the involvement activity knows why people are being involved. Clarity of purpose, transparency, and the intended outcomes should be agreed from the beginning.
All support each other, everybody that knows everybody kind of supports each other.
Presence. Service users and carers need to be involved at all levels. At the individual, community, operational, strategic, monitoring and evaluation. There needs to be a diversity of service users and carers involved. Process. We need to be involved at the very beginning with the development rather than just delivery. Process needs to be carefully planned and thought through to ensure that service users and carers can make the best possible contribution. Information should be made widely available through a number of channels. This may mean adopting non-traditional approaches, such as outreach, working with mediators, and working in diverse communities. Flexibility must be built into the process to enable people to take advantage of different opportunities. There needs to be sensitivity to language, and meetings should take account of those involved and consider reasonable adjustments. Decision-making processes need to be open and accessible and collaborative. There needs to be support, peer mentoring, and training. The ultimate goal is to improve lives, inclusivity, equality of opportunity, and fairness. A commitment to change.
With involvement, don't sort of stop when you feel it hasn't worked the first time. I think that was an important message, that learning from experience in terms of involving people is really important, because it can actually, build for much better involvement the next time round.